Hello. Okay. Today we're gonna talk about knee injuries. For the knee injuries, which whatever, if it is ACL, MCL, LCL, all of them, we're gonna do almost the same rehabilitation, the same approach. You go to your treatment, you go to your massage therapist, physiotherapist, osteopath, whatever, and you have them work on the muscles, reduce the trigger points, etc. Whether it is myofascial release, trigger point, grasping tools, soft tissue mobilization, instrument assisted soft tissue mobilization. Those things can also help a lot when we are working on the ligaments to improve or enhance and speed up the healing process. Yet very important, you're going to do the 80% and more in the rehabilitation. This is very important. So we're gonna start working out. So we're gonna start with this. You're gonna strengthen all the muscles that's crossing the knees, which are the hip flexors, the knee flexors and knee extensors. So knee flexors and knee extensors. We're gonna start with this, having them this way. What you're gonna do, you're gonna start doing steps to the side. Focus that the knees are stable and strong, and make sure you are actually activating those muscles around it when you are walking. Slow steps to the right, slow steps to the right, slow steps to the left. Controlled movement. And then again, you're gonna do forward, and also you're gonna do backwards. So here we are going four motions: side, side, forward, backwards. The other one, we can just have a TheraBand or something connected to a strong pull, and have a TheraBand here, and we're gonna do inwards too. So inwards, backwards, sideways, and forward. Plus the walking. And then you're gonna do. I will always say like between 8 to 12 reps, because we are strengthening here. 4 or 5 sets. The other one will be glute bridges. You can have your elbows or hands on the ground, which make it easier, and you're gonna bridge. Harder if you do this. This is harder, and then slowly you're gonna develop to do on one leg only. And again, you're gonna do 6 to 12 or 8 to 12 for five sets. Very important. I think when it's acute, when subacute, you're gonna do hot and cold. So we call it just hot and cold, like contrast. So you start with cold for 1 minute, 3 minutes hot, 1 minute cold. You finish with cold, start with cold. So you can repeat that 3 times. 1 minute hot, 3 minutes, 1 minute cold, 3 minutes hot, 1 minute cold, 3 minutes hot, 1 minute cold, finish. You can repeat that as many times as you want, maybe like 3 or 5 times. You work yourself, go to wherever the pain is, and actually, if the pain is here, go and kind of like do some friction on it. Slowly. Don't be afraid from moving. Don't be like, if you want to move, you want to try to do squats or stuff, it's okay. You have to stop just when the pain starts. You have to come back and keep doing the movement, because with movement you are initiating and giving signals to the area to get better and to heal. That's very important. Food is very important. If you check with your, I'm not a dietitian, so check with your dietitian. Anything with high collagen and vitamins, you need that to rebuild the ligaments. I wouldn't advise anything with that. It's not my expertise, but I would like if you go to your dietitian. That's very important. Some movements are like that, also very helpful. Keep your heel on the ground, bring it down until it's pain, and stop. Maybe hold a little bit, try to activate these muscles, the hamstrings, and then again down, and then you can go up and down, activating the quads too. And then you can do the side, the clamshell one. You can do that without any band, and then you can also do with a band. You can put the band here and start doing That's very good to strengthen these muscles and support the knee. You will feel the knee is more stable once you are doing those movements. You do them like they just give them 24 hours or 48 hours sometime to make them relax and build, because they're becoming stronger. So again, I will also do things like that. And again, I will do the hamstring and glutes this way.
Okay.
All of them, just make them all. You'll watch this video as many times as you want. Repeat them and do again. You stop each movement I do. You stop, do it 10 reps, 5 sets. Relax, and then move to the second one. Relax between them as long as you want.
Okay.
Yeah. After in a chronic position or a chronic stage, you're gonna just put heat then. So I would say the first 3 weeks you just maybe, or the first 2 weeks ice, and then the other 2 weeks, the next 2 weeks, so third and fourth week you're gonna put cold and heat contrast, and then the next 3 or 4 or 5 or 6 weeks until you're good, you're gonna put just heat on it. Yeah, heat, and I would say again 5 to 10 minutes of heat.
Okay.
Yes, that's it.
Awesome. Thank you.